Yeah, thank you, Karen, for having me. Happy New Year, everybody. I am a pediatric dermatologist. I've been at Texas Children's Hospital in Houston for over 20 years. And I'm going to talk about port wine birthmarks and Sturge-Weber syndrome. And it sounds like there's a variety of families on the call today. Families of new babies, families of older kids, some adults. So I tried to put in a little something for everyone in this talk. So hopefully that's helpful for you all. And so just to start, things most of you know, Sturge-Weber is rare. The findings are congenital, meaning that they're present at birth. It's a sporadic syndrome, meaning that it's not inherited. And it involves abnormal blood vessels that affect at least 2 or often 3 of the following. So vessels of the facial skin, which presents as the port wine, affects vessels of the brain, which we call leptomeningeal angiomatosis, and it can affect vessels of the eye. And what causes Sturge-Weber? Well, we know it's a gene mutation in a gene called GNAQ, and that affects blood vessels. And it's somatic. And somatic is the term which means that the mutation occurs after conception, after fertilization of the sperm and egg. So the mutation occurs only in tissue, and it can not be found in the blood, only in tissue. And that's why that the gene is not inherited. So a port wine birthmark is also known as a port wine stain, and it was actually the Sturge-Weber community who has made a movement to change that nomenclature from stain to birthmark. And I love that. I think it's such a positive change, and I try to share that in every talk that I give. The other term, the medical term, is capillary malformation. That just means the type of blood vessel that's affected in the port wine. They're present at birth, they're flat, they're not raised, they're various shades of red. They respond to body temperature, and they also respond to hormones. So oftentimes after birth, the birthmark will start to get a little bit lighter in color due to the decline in maternal hormones in the baby. And people will think that they're going away, but then they will eventually darken again. And they're well demarcated, meaning that you can clearly see where the birthmark starts and stops. And we know in Sturge-Weber that the port wine birthmark typically affects the forehead, and it's large. And it's usually large on the forehead and more extensive than that. So meaning it affects the whole side of the face many times, or both sides of the face. So the 2 patients on the left would be at low risk for Sturge-Weber, the classic form, because this child has no port wine birthmark on the forehead, and this child does, but it's small. And then these patients have a gradually increased risk for Sturge-Weber because large forehead plus whole side of the face, and then both sides of the face in this patient. And this situation is much less common, but even if you have a port wine birthmark that affects the middle of the forehead, no matter what the size, that's also considered high risk for Sturge-Weber. So what do? Well, they persist throughout life. They grow proportionally with your child. And then they often progress at puberty or later in adulthood. And what I mean by that is they can get darker in color. They can get thick and raised. There can be bumps that develop that are red and may be prone to bleeding. And we see that more often when the port wine birthmark involves the center of the face. And why do these changes occur? Well, there's a number of reasons. Hormone stimulation, as I mentioned, that GNAQ mutation is always there. So that's part of it. But progression is really uncommon in early childhood, though sometimes in young children, you may see an eczema type rash, like a dry, itchy rash that occurs over the port wine birthmark. So this is an example of progression where you're seeing the darkening of the color, the purplish discoloration, the thickening, some of these bumps I was talking about that are vascular and can be prone to bleeding. And this is an example of the eczema type changes you can see in younger children. And we treat this just like we would eczema in other locations of the skin. So good moisturizer like Vaseline or Aquaphor, and then topical cortisone type prescriptions if needed for redness and itching. So the evaluation of your child is based on the location of the port wine birthmark. So if your child's at high risk as a newborn, there's a large port wine on the forehead, it's more extensive, that a neurology consult is indicated, right? And that's mainly in the newborn period for seizure education for the parents. and then eventually to follow neurodevelopment and make recommendations as far as imaging. And then if the skin around the eye is affected with the portwine birthmark, there is a risk of increased pressure glaucoma in the eye. I know we've got an ophthalmologist talking today, but it's important to know that glaucoma can be present at birth, but your child's also at risk of glaucoma throughout their lifetime. That's called acquired risk. And so it's important your child's followed by ophthalmology throughout their lifetime. And that's true whether the birthmark affects the upper eyelid, the lower eyelid, like this patient, or both. So what is laser? Okay, so laser is a device. Every laser, there's many types of lasers out there. They are all characterized by being characterized by different wavelength of light. So for example, the laser that we usually treat for portwine birthmarks, the pulse dye, the wavelength of light for that laser is a number 585 to 595. And every laser wavelength targets something in the skin. Okay, so the target in portwine birthmarks is hemoglobin, which is a red blood cell protein. It's part of the endothelial cell that lines the blood vessel. So that laser targets that blood vessel, targets the vessel, fragments that vessel apart by means of light, destroys it, and then the vessel resorbs. Okay, it heals. So by that, selective means that the laser affects the blood vessel, the endothelial cell, with little damage or no damage to anything else in the skin. And photothermolysis means you're using light to damage that cell, and then it heals. So the gold standard laser for portwine birthmarks, especially in babies and young children, is the pulse dye. Most of us have the Candela V-beam Perfecta, but there's also the V-beam Prima, which is the more recent model out there that I'll talk about in a little bit too. So to laser or not to laser? So this is an important question because there are pros and cons. And if there are those of you out there thinking about this, I wanted to go through this. So, I have patients over the years that are very sure they want laser and families who are very sure they don't, but then I have quite a few that are in between and seem to feel heartbreakingly so guilty or bad whether they decide to do laser or not. And I just want you all to know that there is no right or wrong answer. You need to do what's in your heart, what you feel is best for your child and for your family, because laser is not perfect. Okay, the pros are that we all want to improve quality of life for our children down the road, right? We want to improve confidence, self-esteem. We don't want them to be bullied when school starts. And we hope, at least, that we can reduce some of those skin changes I showed you, the discoloration, the darkening, the thickening, the bump development, at least on the surface. The cons are that in most cases, we can improve the portwine birthmark, but we can't remove it completely. And often the improvement's not permanent, it's temporary. And why is that? Okay, so what happens is that the laser only penetrates, especially the pulse dye, a certain layer, the top layer of the skin. It does not go very deep. And if I were to biopsy your child in different places, same portwine birthmark, you'd see vessels at different depths, vessels of different sizes. So it's really hard. Many times we're trying to decide, gosh, what should we do? How should we use a laser to target those vessels most precisely? And so there are efforts right now being made to use, for example, imaging to figure out how big the vessels are in your child's birthmark, how deep they go, so that we can more accurately use our lasers. But until then, oftentimes the laser doesn't go deep enough to get all the vessels, or the vessels are too large for the laser to be effective. We also know that laser requires multiple treatments. There are risks, there are low. There are anesthesia concerns, there's downtime, and last but not least, there's financial burden, right? So even if the laser is covered by insurance, you've still got potentially travel time, lost time from work. So laser is a big commitment. How many treatments are needed? Well, what's often quoted is at least 8 to 10, but that's very variable with each child. It depends on where the portwine's located on the face. So the outer part of the face, like the temple area, the eyelid, responds faster and better than places like the middle of the cheek or above the lip. Size matters. So we know that more extensive port wine birthmarks like we see in Sturge-Weber that involve the whole side of the face or both sides are more challenging to treat oftentimes and require more treatments. The blood vessel size and depth, like I just mentioned, matters. And then the age of the child when we start treatment, we believe matters. So I'm just going to talk a little bit about this. You're going to read about this, advantages to starting laser as early in infancy as possible. And if you're a family who didn't have laser, your child didn't get laser in infancy, please don't worry. This is somewhat controversial. Not everyone agrees that lasering early is more effective, but I just want to go through the rationale with you all. So the rationale is that we believe laser may be more effective in young infants. And why is that? Well, infant skin is about half the thickness of adult. So, and the blood vessels are smaller, they're more on the surface. So we can target that birthmark more effectively, right? Because the laser, again, only goes so deep. And infants have an increased amount of a certain type of hemoglobin, which also makes their birthmarks better targets for laser. I can also usually do a number of those early treatments during infancy without general anesthesia, which is advantageous because the Food and Drug Administration of the US has expressed concern about repeat general anesthesia in children under 3 years of age and potential effects on neurodevelopment. So the more treatments we can try to do without general, we try to take advantage of that. And then starting in infancy does reduce the burden to your child somewhat. So as you all know who have older children, as your children reach certain developmental stages and ages, they may not be too excited about going to laser. They may be anxious about the procedure or the mask. So that's to keep in mind. And also the post-laser bruising from pulse dye, those purple dots that you see are not a big issue to an infant, but can be a big issue for a school-age child. Having to go back to school with that can be worse than the birthmark itself. So then you're trying to decide, well, gosh, should we do laser at Christmas break or in the summer? So it does become more problematic as children get older. How often to laser? This is also variable, but in general in infants, I try to repeat laser every 4 to 6 weeks. There are some studies that say every 2 weeks is better, but others that have discounted that and said, every 2 weeks is not better. I think the main thing to know is that you really need to have that purple bruising completely healed before you repeat that laser to reduce the risk of side effects. Toddlers, once we need general anesthesia, I generally repeat those every 2 to 3 months. And then once children are school age, once we're at maintenance phase. So maintenance phase, I describe as once we've reached a point where we've gotten the birthmark as light as we can get it, and we're just trying to maintain that lightening, I will repeat the laser maybe once yearly, or not so often as that in some kiddos too. But just keep in mind, closer follow-up is needed at puberty, just with the changes that can occur, progression at that age. So what are the risks of pulse dye laser? So the bruising, like you're seeing here, of course, is to be expected. If you see no bruising, you wonder if the laser's been effective. So that's what we call a therapeutic endpoint. Damage to the eyes is the biggest risk. So your laser surgeon will be very careful about this. So when I'm doing laser in an infant, I have a nurse that's her only job is to keep those eyes securely covered with gauze the entire time I'm lasering. In older children under general anesthesia, after the child's asleep, we insert a little metal, it's called a corneal protector. It's like a little coin that goes inside the eye after your child's asleep. Is removed before they wake up. There can be skin discoloration from the laser, either lightening or darkening, and that's because the pulse dye targets the blood vessel, but it also targets melanin, the coloration of your child's skin, to a minor degree. So it's usually temporary, but that's why we say sun protection, sunscreen SPF 50 or higher is super important before laser and after. Blistering can happen, so it's not uncommon for my patients to get a blister here and there, last a day or two. We just use moisturizer, Aquaphor, Vaseline, and that typically heals. Scarring does happen, but scarring with pulse dye laser is pretty rare. Swelling can happen, especially eyelids and lips. Last a day or two. Ice packs for older kids is fine. Babies, I wouldn't worry about it. That will bother them more than the swelling itself. And then hair loss is controversial. It seems to be temporary and rarely permanent, but when I have a child who's got dark eyebrows, dark hair, I typically laser around those areas and don't go up into the hairline or treat over the brow just to minimize that risk. So what if your child has skin of color? Can he or she still have laser? And the answer is yes, though with some modifications. So there's a higher risk in a child of color of skin discoloration from the pulse dye laser. So sun protection is extra important. I often will treat children of color. I'll space those lasers further apart. So for example, instead of every 4 to 6 weeks in an infant, I might go every 2 to 3 months. And that's to make sure any discoloration that happens resolved completely before I laser again. And I'll often make some adjustments in my laser settings, the things that I can change to account for skin color. Okay, options for pain control. In infants, swaddling and holding is good either by the nurse or the parent if they are allowed back to the laser room. I use sucrose on a pacifier. Also, this is used a lot in the NICU for various things for pain control. The product we use is called Sweetums. You put a couple of drops on the pacifier 2 minutes before the laser, and then you can repeat it. The use of topical anesthetics like lidocaine is controversial with laser because lidocaine shrinks blood vessels to some degree, and therefore there's concern about reducing your target, right? Reducing the effectiveness of the laser. So since I'm not sure always how much the topical anesthetic helps because the procedure is so quick, I tend to not use them more than use them. But you can also use infant Tylenol before the procedure or after. In toddlers, I would say up to about age 12, general anesthesia is typically necessary for safety and comfort when we're lasering the face in particular. And as I mentioned before, as children reach a certain age, they can become anxious. And every major pediatric hospital should have these neat people called child life specialists. And they are designed to talk your children through procedures in age-appropriate language and explain, oh, here's the mask, let's try it on. That's usually the part that they're most afraid of. Let's practice that. Let's choose the flavor of the gas you're going to smell. They will go back with them to the room. We even have music therapists that will play the guitar and play songs and sing to them. So those kinds of specialists can be super helpful for your older children. A common question I get is my child has had over 20 pulse dye laser treatments and the birthmark isn't gone. What else can we do? Well, I'd say the first thing is realistic expectations. As I mentioned, our laser technology is not perfect yet. We can lighten it, but there are, it's not perfect. Can you adjust the laser setting? So oftentimes I'll try to make sure those blood vessels are as big as I can get them, maximize my target, right? So I may put warming blankets on my child's face. I may rub it, the birthmark. I may put their feet above their head so I can try to maximize the laser target. Sometimes I'll do things like, I'll do one pass of the laser with on the surface, and I'll go a second pass a little deeper. I try to increase the energy of the laser as much as I can. The V-beam, the Prima I mentioned before, the newer version of the pulse dye, has the ability to use a larger spot size and increased energy. So that might be an option. And then I get a lot of questions about alternative lasers too, like alexandrite and ND-YAG. So I just wanted to mention these. So so look at the numbers here. So I mentioned pulse dye is a wavelength of light, 585 to 595. These are higher numbers, right? 755 for the alexandrite, 1064 for the ND-YAG. The higher the number of the wavelength, the deeper the laser goes, the larger vessels it can target. So that's great, except that there are side effects that go along with that. So in particular, with the ND-YAG, scarring is a big risk and eye damage, even if you have appropriate eye protection. So I have a lot of respect for these lasers. I am very, very careful with these lasers because even a tiny increase in the strength can mean the difference between improving your child and causing scarring. And to be honest, there's very few pediatric studies looking at these two lasers, and the results have been pretty modest. So most of us who do a lot of laser would not use these lasers in a young, an infant or a young child, because pulse dye laser works so well with minimal risk. So I typically reserve these for, adolescents or adults who are showing signs of progression, who are no longer responding to pulse dye, and or if they're children of color, or adolescents or young adults of color with skin of color, because these lasers target melanin less so than the pulse dye does. And then just to mention support, the Sturge Weber Foundation is fabulous. But as your children get older, there's a camp that's sponsored through the American Academy of Dermatology called Camp Discovery. There's various camps throughout the country. Your dermatologist will recommend your child for this camp. It's just a week of children with all different kinds of birthmarks to hair loss to everything. It's just a week where kids can be kids. Everyone there has got something on their skin, so it's just a chance to enjoy each other, and it can be a really life-changing week for a lot of kids. And then there may be local resources, like in Houston, we have an organization called the Children's House for the Soul that provides support for young school-age children, teens, kind of like camp, but they'll do day activities that are designed to provide socialization and self-confidence, like they may have a day of, hair and makeup day. So I would look into those kind of resources for your older children. And then lastly, I just wanted to say that there's a lot of hope out there. So some of you may have tried a topical medication called rapamycin or sirolimus. That's kind of the start of this. It's not the end point yet. I don't think that that's the right medication for port wine birthmarks, but targeted therapies are medications being used now to target those genes causing your child's birthmark. So right now, for example, I'm doing a clinical trial looking at a gel medicine on the skin for a different type of vascular birthmark, different gene. But I feel very, very hopeful that there's going to be something like that coming out pretty soon to target GNAQ, the gene that's mutated in port wine birthmarks. So I wanted to share my favorite quote. So it's hope is one of the three great theological virtues, the other being love and faith. They are like three sisters. Two of them are grown and the other is a small child. They go forward together hand in hand with the child hope in the middle. Looking at them, it would seem that the bigger ones are pulling the child, but it's actually the other way around. It's the little girl who is pulling the bigger ones. It is hope that pulls faith and love, and without hope, everything would stop. So I thought that was a really nice quote to share as we're heading into 2022. I really appreciate being here. Happy to answer any questions at the end. Julie, I'll be here at the end. And thank you for listening.
Dr. Metry, thank you so much. That was wonderful.